Move this to the side, and then we'll start with our level 1 introductory workout. Okay, so what's the first exercise you want to do with him? So what is the first exercise you want to do with him?
Supine lower extremity.
Something. Supine lower extremity what? Okay.
Well, we talked about doing open chain at the beginning.
Yep.
Pieces.
So remember we determined he's a stage 1.
So if we're going, so we could do reformer. Oh, no, this is the first thing.
Reformer's okay. That's
Yeah.
all right. You don't have to start with mat.
Okay, so I would start then with the reformer and straps
Okay.
or footwork.
I think footwork might be a better
Footwork
choice.
probably,
Overweight, deconditioned 38-year-old male with legs straight in the straps might not be as good. So I would love to see footwork in the program. So you've got reformer footwork. What are some other good choices for the stage that he's in?
Well, I would definitely be doing, probably before footwork personally, I'd be doing some basic math with him just so he understands.
And what does basic mat look like?
Even dead bugs and
Yeah.
the femur arcs.
So
and,
dead bugs.
Maybe before you do
alignment.
that, you need to
Uh-huh. Yeah.
Yeah, but we're not going.
But that's
yeah,
okay.
We're going to go through that's re-education.
That's
We're gonna-
okay.
We're going to talk about.
And you're going
the
to
curves
talk
of the
about
body
pelvic
and-
awareness here and breathing and things like that. That's
And breathing and learning how to breathe.
uh-huh. Yep.
Breathing exercises.
Yep. So with breathing,
Mhm.
you're going to teach him maybe diaphragmatic versus costal breathing. Mm-hmm.
Helping get out of pain.
Mhm. Because breathing may help him get out of pain. That's right. So that could be a mat type exercise.
And maybe even some bitten fallouts.
Yeah. Mm-hmm. So you get that hip disassociation. Good. Okay. What's
You
yeah, yeah.
were talking about doing the rotation exercises.
Mhm.
Like the book opening.
Yeah, so the book open, he likes side lying. Remember, he liked that. So that's great. So book openings, especially with right side up. And he liked laying on his left side.
Yeah.
So, right? Okay. So I always tell right side up, or painful side up is the way I remember that.
And then we're going to do some prone extension.
Yeah.
In reverse
Okay.
to that, so that he can, use especially.
Mm-hmm. He likes prone extension, so that's a good one to start with. So it doesn't mean you're moving the lesion site, though. You're keeping L4-5 still as he articulates his thoracic spine. So that's also a great exercise to do as well, because he can get that thoracic.
Education of the pelvis and
Yeah.
how to manage that.
And you want that posture to get better, you want the thoracic extension. What's a way that you can incorporate a piece of equipment to assist him with this movement before you did it against gravity?
One of the exercises that we have in the rock.
Yeah.
I actually love having one of the chairs at the end of the trap table, so that I can block his lumbar spine. People just get the idea of coming to a couple of seconds and do that.
Yeah. The only thing is I would say is that he needs to be able to do quadruped and lower himself down, and he's deconditioned and overweight and hypertensive. So I might be concerned about him just getting on there and lowering himself down onto the chair.
Laying down on his belly.
Lowering himself down, crawling out to the chair and putting his hands on the pedals. I want to teach him quadruped first, and that's all I'm mentioning there. And I love the idea of teaching him quadruped, and that would be great. How would I assist him, though, with this prone extension? I know he's assisting with his hands, but what is a piece of equipment? Because we've only got one apparatus here. We need the rest of the apparatus.
I would use the track wheel.
Okay. How would that assist him with thoracic
We
extension?
could, with the bar.
Okay. So he could do the swan.
Yeah.
Yep. Okay. What's another little more simple thing that you could do with thoracic extension?
I know you're after something I'm looking for.
He could be face down and do swan with the chair.
Mm-hmm.
And,
So what's a way that gravity can assist with thoracic extension? How do you?
If I were to put him over a half bear, I'll bring him
Oh,
up.
Yes. How about the spine corrector? Exactly. So the spine corrector, you could put it on the trapeze table, have him bend his knees, sit in front of it, and do the supine thoracic extension. Yeah. Okay. And then now we need to, and you said the swan on the trapeze table? Mm-hmm. Okay. Okay. And then is there something on the chair that might be good for him? And maybe it's not appropriate.
Well, I mean, if it's appropriate, it doesn't work so he's sitting up and doing deadly pump.
The only thing is, yeah, sitting, he can only do that for 5 minutes, so I might put that in later.
Yep.
What about doing bridging in front of the, or not the bridging, but the single leg pump lying supine? Or even double leg pump lying supine, so they're lying in front of the chair.
Sure.
The frog lying flat, yeah, frog lying flat, something like that might be a, if you gotta get a chair exercise in there, that might be a good one. And you could always, as long as you teach quadruped first and make sure he's okay in quadruped, and then you have him go out onto the chair, that's all I would say is that, you know, if you wanna teach him the prone scapular series or prone extension on the chair, then I would make sure he can do quadruped first. Okay?
Yep, yep.
All right, good. Okay, so that's a good intro workout. How are we doing? Do you need to go?
I do, but I have a quick question. So when you're doing your introductory workout, am I really just focusing on all of the exercises that I would begin with, or am I thinking, okay, supine, upper extremity, supine, lower extremity?
Yeah, we'll go back to that. Okay, so we can go back to that. I want you to think of that as a way to look back at your program and see if you got everything you need in there.
Okay, because I like the idea of just like throwing out all the exercises
Right.
I think I'm going to use and then putting
What do you think is most important for him? And you go back and look at your categories. Now, we don't have a seated or standing category, but why not?
because
That is provoking to him. I might not want to start my first session with any standing or seated exercises. Maybe at the end, I might do a seated exercise or a standing exercise because he's got to sit in the car to drive home.
right.
So you might do some seated leg pumps on the chair or do something like that just to show him the way to sit and the way to stand up, because that's something he's going to have to do right away. But yeah, so that you might not have something in that category every time, and that's okay. But you've got your supine, you've got your supine. You could have done arm arcs here. You've also got some arm work here, so you've got some rotation. You've got your extension. Uh-huh. Yeah, yeah.
And then you could judge if he has
Right.
the arm capability to be able to do swan on the trapeze.
Right,
Because
right. Because you haven't really looked
So
at
before we
that
do
shoulder
swan
flexion.
then protraction, retraction there.
Yeah.
Table.
Yeah, that's okay. I mean, you probably would, you know, just get him in that position and then get him to do that thoracic extension. But again, you could do standing leg pumps with the right leg in the pump position. You could do sit to stand, you know, type of more functional activities to help them with the pain that they're having with those activities. All right, and then quickly going on to the next level, how would you progress the client to the next level? So what exercise might be the progression of footwork on the reformer? And what do you ultimately want him to do? Okay, yeah. So we could go to feet and straps now. It's been 6 weeks. I didn't mean to do that. Reformer, feet and straps. Okay, that's good. It could have been trapeze table, footwork on the trapeze table. That's a little more challenging, but it has a little bit more stabilization. So remember we said we wanted to kind of do closed chain before we go to open chain, which is a good segue, but that's fine. Feet in the straps. What else? The dead bugs, what's the progression of dead bugs and femur arcs? We said we were talking about dead bugs and femur arcs here. What would be the progression there?
Well, there's a couple of different techniques you can use for progression.
Yeah.
It depends on what your goal is. But
Mm-hmm.
I might start some basic supine abdominal work.
Yeah, yeah. So what about chest lift? Because we can't start doing high level 100 and all the more challenging long lever arm abdominal work without helping him understand how to curl up and not pull on his head and not cheat to get up and really use the abdominal wall, stabilizing the lumbar and the pelvis as he flexes up through thoracic. So the chest lift would be good. He could also do a little bit longer lever arm with these dead bugs and femur arcs. So what might that look like?
Now, this is the assumption that he could put or he cannot put his legs in tabletop and hold himself
Mm-hmm.
in position.
So you could progress to that tabletop position and maybe extending one leg at a time, because I wouldn't jump to the 100 with this man, you know, with that poor abdominal awareness and all that. So
Leg, stretch leg at a time.
yeah, so single leg stretch. And you might even do it with the head down, you know, with it propped up on a pillow, yeah. Okay, and then we're going to carry that breathing forward into any exercise that we're doing. We wouldn't necessarily just do breathing by itself. Now we've got bent knee fallout, which is more of that hip abduction type exercise and articulation, disassociation of the hip. How might we?
So might, at that point, make sure that I start using some sideline exercises, like you have the pre-Pilates sideline.
Yep. So side lying. And he might even do side lying here and be ready for side kick at this point.
Maybe not with his, not up on his forearm, but maybe laying down on his arm.
Yeah, good, good. The other thing I like about this is more like adductor and sort of control. I would love to see something like horseback, because horseback is sit to stand, right? It's training for sit to stand, and really getting him to understand how to use his muscles as he goes up into from a sit to a stand position, because that's one of the hardest things for him, and that may give him some relief to his back. So I'd love to see horseback in here on the ladder barrel. And you could put the box up there to help him get on there, and he wouldn't have to throw his leg over. You could just put the long box up and get him on there. And by that point, maybe he could do that. I'd love to see that in there, though. Okay, so what about trapeze table and chair work? What other kinds of exercises might you do on the trapeze table or the chair?
Well, at this point, we should clearly be able to do, use the wonder chair the chair at the end of the trap table and be able to do extension work.
Yep. Yeah. So we had the swan, okay. So chair, swan. And you might even do some of the with rotation. Okay. And now something on the trapeze table.
I might even begin to.
Because that doesn't count as a trapeze table exercise, even if you support it.
Okay, that's all right. That's okay.
Yeah.
You might even be able to start to do some leg springs at this point.
Yeah.
Single or both together.
Right.
To see how it tolerates that.
Okay.
For a leg spring.
Since he likes to be in sideline, you can maybe some hip openers.
Yeah. Yeah. Okay. You may have to modify that for range of motion, but that's okay.
Leg pump.
Standing leg pump.
And
Yeah.
then
So
that
let's go
starts
back and add in
that.
the chair standing leg pump. And you could face forward or side as well to get that progression from the bent knee fallout. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So you want 10 to 12 exercises for your intermediate workout. You want to have a sensible progression. The one thing that's not in here that I would like to see in this program so far is quadruped, because that's going to really set him up for some more challenging exercises like push-up, leg pull, inverted V, things like that.
Why don't we address it in the introduction? We're going to ask doing quadruped and maybe then add quadruped reformer in the
I agree. I think adding it in here, because that's what you can do is when you go back, you go, oh gosh, I've got this high level exercise in here, but I don't have the precursor to it. The precursor to all the long lever abdominal exercises is going to be the chest lift and then the dead bug and femur arcs. You got to have those in there if you're going to do the 100 or high level exercises. especially for a low-level client like this. And if you're going to do push-ups or any other exercises where they're prone, as far as even getting onto the chair, even the the jackrabbit, and your inverted V and all of that. Eventually in the future, those you don't have those yet, but the quadruped is going to be important.
So then we would progress quadruped to plank?
Yeah, just maybe a hold, just a leg pull without the leg lifting. Yeah, you could just have him hold that position, and it could be up on the trapeze table. You could modify it so that he is more of an angle that's easier for him. Okay, so can we quickly do advanced exercises? All right, so we have 12 to 15 exercises for the advanced workout, and now you have to imagine that you are the best teacher ever, and he is a superstar. So let's do our advanced workout. So we've chosen footwork, we've chosen feet in the straps as starting exercises. What might we choose here?
And you can do the footwork on the trapeze table.
At this point, he can also start to do some spinal articulation. He might even start here. We did some spinal articulation, but we might be able to do a little bit more. So what's another exercise on the trapeze table that might be a nice one to start with? Feet on the tower bar. Never want to start with push through. Yeah, you would never want to start a client with push through or a flexion exercise as a warm-up. That especially when they've had a disc problem. Especially. You've got to get the body warmed up using the large leg muscles. That's why we want to start with leg strengthening exercises of those large muscles, getting those large muscles warmed up. And we don't want to start to mobilize the spine until the middle of the session so that they're really warmed up.
At this point, even though I know one of the things that I would do, I'd probably at this point you should be able to hold tabletop legs. And we've been doing some preparatory abdominal work with the chest lift, and you should be able to do the 100. And it is considered as somewhat of a warm-up exercise too.
Right. So I might put it a little bit later. Because remember, our categories are for us to help keep our clients safe. So we want to start with large leg muscle exercises, usually in supine, and then to arm exercises, and then going into weight bearing of the upper and lower extremities, and then into mobilization of the spine. And I know that your category says spine extension, but it's spine extension, it can be flexion, it can be rotation, it can be side bending. So any mobilization of the spine there is appropriate. But I like to put those more toward the middle of a program. So you could do bridging though, and that's a little bit of articulation and not so extremes of range of motion. Because what you have to think about is if a client is cold, very first thing in the morning, and they have neurological symptoms due to a disc bulge, that the discs are imbibe water during the night. So the discs are full of fluid at night, and they are much more susceptible to bulges in the morning. So if you start a program with somebody doing extremes of flexion, that's going to be an issue for a very high risk activity for them.
So then would you have him on the trap tail doing like a leg press?
Maybe like parakeet. Parakeet would be a great one. So it could be footwork, parakeet.
Just the footwork first.
Well, he can do it. He's in advance, like you said. You're a superstar, so you got him. He might be able to do it with 2 red springs, with lift it up, and he's doing great because this is 6 months down the road. This is not necessarily just 6 weeks later. This is 6 months later, maybe a year later. That you don't want to think of it in such short of time frame, especially for a client like this. Getting to the advanced level is going to take him a lot longer because he's sedentary. So he's not a dancer. He's not a mover. So you're not going to progress him as fast as you would somebody else. But it doesn't mean you stop him from his progression because this may be 1 year or 2 years later. All right, so maybe footwork and parakeet. What else do you have as options on the trapeze table?
And be doing swan on the trapeze. Probably.
You have swan in your previous program. Yeah, we have in the beginning. You don't want to repeat exercises, mainly because we're looking at the full gamut. So one of my favorite exercises for core control is on the trapeze table, and which would be a perfect segue for him at this point. And that would be the going from quadruped to the hip extension on the trapeze table. That would be a great one for him. So you've got your 3 exercises that are going to help him achieve his goals, help him get better hip extension, great for gait, great for dissociation at the hip, and then that core control. Okay, and then what else can we move him to? We can start to do some challenging core control exercises, or we can do some more challenging exercises on a different piece of apparatus as well.
You do teaser 1 on chair?
Mm-hmm. You could also do something like start to include some flexion for him at this point. You know, so once he gets more toward the middle of his session, he's nice and warmed up. You could do something like kneeling cat, which with the legs bent, incorporating the flexion is going to be less risky for his sciatica issue. So you could do, I would say, either kneeling cat or hamstring 1. Because to me, those are some of the best ways to incorporate spine flexion into a program. And that with the legs bent especially. I'd rather start him with flexion with the legs bent than with the legs straight. Okay? And then you said, and so we're going, if we're on the chair here, we can do kneeling cat on the chair as well, but if we're on the chair, we can go right into doing the teaser. I'm sorry, you said teaser on the chair. Yeah. And I like to put the box in front of the chair the first time people do it and put their feet on the box, and then they roll down onto the chair. So with this guy, I might do that because he's quite upper body heavy. It seems like he's overweight. He's lost weight by now, though, and he's doing great. So we need to, again, think about spinal mobilization. Remember, that was one of his goals. So we've had the chest lift, which is thoracic flexion. We've had the swan and the supine stretch, which is thoracic extension. So what types of exercises might take that further into full range?
Doing the sit and reach.
Yeah, roll down reach. That would be great. Okay. And what else? What are some other really great, challenging seated exercises that are going to help him with his core control in a seated position? I'm giving you a little hint there.
Well, you can do it on the chair. You can do doubling something on the chair. You should be able to be seated
Right.
at that point and be able to do it well.
Exactly. You could do double leg pump with some sitting on a wobble board or disc. Okay. But what's something even more challenging than that? So think of your core control exercises or your abdominal exercises that are in seated position.
Roll over.
Yeah, that might not be a choice for this person, only because of the issues with
the
hypertension and the flexion, and so
That would not be.
yeah. So I wouldn't pick that. But what's a seated exercise?
Well, I'm wondering if we could, as guide this, at this point you should be able to do push through a little bit.
Yeah.
Yep.
Yeah, you could do push through and start to work on that and see if he has any symptoms with it. But what about the short box series on the reformer? You could even start with some hinge, just the flat back, hinging back and forth, and then progressing to curls. Yeah, no, I mean, because we were on the spine corrector, so we need a reformer. So if we did short box on the reformer, yeah. And just looking at some of the choices we have here. Okay.
Well, you also at this point
Because-
doing quadruped on the reformer or knee stretches on the reformer.
Yeah.
Knee stretches.
Yeah, so we could have progressed him to quadruped, but knee stretches would be great for this particular stage. And what do you think is the ultimate disassociation pattern for the reformer? So
Quadruped exercise.
yeah, sort of. It's a preparation. Quadruped is a preparation for this exercise. Yeah, the inverted V. I would love to see him do the inverted V. Right. And then what exercises are going to help him with gait? Because we've got some things for mobilization of the spine. Got a few things here. We've got a rotation exercise over here. So we want to make sure we've addressed all of the motions of the spine. We don't have any side bending yet. So we need to improve. We said we were going to improve that spinal mobility. So we need a side bending exercise in there.
Well, he should be able to do side sit-ups.
Yeah, how about some mermaid? Yeah, mermaid would be great. So we can do it, we could do either the side sit-up on the spine corrector, or we could do mermaid on the chair would be great. I would stick a mermaid in there on the chair, and you can also add rotation with that as well.
Use the chair, even the trap table, you can do the side.
Yep. So I would either do side sit-ups on either the spine corrector or the short box. That would be great. I mean, not the short box, the ladder barrel. So those are challenging, but yet they're also working on mobilization. Now, what about gait? How are we getting his gait better? Because that's something we want to address in the Pilates studio as well.
At this point, he should be able to do forward lunge on the chair.
Yeah. So I don't know that you have that yet. Okay? You don't, yeah, that's why I'm trying to remind myself what you have and what you don't have. You don't have that as a choice yet, but I would love to see that in the program eventually. How about the standing series on the reformer? Because you're trying to improve his weight bearing. So that would be a great ending. I would also love to see, and you have room because you have 15 exercises that you can put in here. I would also love to see scooter or standing hip stretch.
Yeah.
That would be a good one.
Maybe at that point, you should be able to do scooters without holding on.
Oh, yeah.
And so it's a more standing
Right,
position.
right, because you don't have the splits yet for him. You don't have some of these really, really high level exercises, which is probably fine for this particular client. Okay, so let's see. Just thinking of what we have in here. We don't have a whole lot of upper body work. We could be doing something like the kneeling arm series. We could be adding some rotation and some mobilization with that, upright. That could be in there as well.
Well, you could be doing standing arms and things with the trap, which we're standing and seeing a lot of people.
But we haven't had that yet in the program. I know, I go there too, but yeah, we're only up to S4, so we have, I'm just looking at the different exercises that we have. Bridging is always a great one for leg strength and articulation as well, so we could have even started with bridging on the reformer. We didn't choose that, but that's okay. The supine abdominal series might also be a nice choice for, yeah, and we don't have reverse abdominals, we could have that in there. Yeah, and then ultimately something like back to forward bend on the ladder barrel. I mean, that would be awesome for him to be able to do that without pain. All right. Okay, then what we do is we go back and we go, okay, do I have my categories? Remember, we talked about our categories here. Now I have supine lower extremity, and I don't have a lot of supine upper extremity, but we have some upper extremity movements here. We might stick in an upper extremity exercise here. We could go into, reformer here, adding in, you might add in the supine arms. Yeah, so that might be a nice one to stick in here. And I don't like to jump around. I like to do 2 or 3 exercises on one piece of equipment and then 2 or 3 on another, so you're not jumping around too much and you're creating more of a flow in your session. Okay, and then we have the quadruped, which is the swan with rotation, is sort of that weight bearing of the upper extremities. We have that. We have the chair standing leg series here. We have leg springs on the trapeze table. We have hip opener. So I would switch this whole chair part here to the end so that you can end in standing with him. So I would take the swan with rotation and the chair standing leg, and I would stick it at the end. I might also stick the horseback on the ladder barrel toward the end too, because that's more of an upright exercise. And you want to prepare the client to go out the door. All right? And then we've got the number of exercises. So we've got an exercise on each piece of apparatus. We've got the correct numbers of exercises. So we've got 8 to 10 in the intro, 10 to 12 in the intermediate, and 12 to 15 in the advanced. And then like I said, we've got an exercise on each piece of apparatus. We've fulfilled the categories. And if we didn't fulfill the categories, we know why we didn't. Like, we didn't put that in there because that was very painful to him. So we don't necessarily want to give him exercises and make him stand for long periods of time if it's painful.
He's a level 1.
Right, he's a stage 1, so we have to be a little more careful with him. Okay, so then the next thing we need to look at is, did we meet all the goals? And so remember, our goals were things like stabilization and dissociation. We definitely have that in there. All those exercises at the very first part of our programs definitely have that in there. We wanted some prone extension with him. That was helpful to him for pain relief. We wanted to get thoracic extension. We wanted better posture. So we need some upright exercises to make sure we've done that. We wanted some open chain lower extremity exercises, which we started with. Progressing to closed chain, which we've done. And we wanted to address the hypertension. So we didn't put any inversions in there. Okay. And then we wanted to decrease the rest in between exercises. So we know if we have 15 exercises over there, he's not going to be able to rest in between because there's not going to be time to get them all in. We wanted functional re-education progressing from foreign to familiar, which we've done in every session, and as we progress, we have more upright exercises. We've addressed gait training by doing some standing exercises. Yeah, standing leg pump, scooter, standing hip stretch, also the standing series on the reformer. And then we wanted a home exercise program. So that we have not given him yet. So all you need to do is go back and take 2 mat exercises from each program and give him a home exercise program. So there is a hole in our program. We don't have any mat exercises in that program right there. So we need to add 2 mat exercises, which is okay.
I did say
That's okay. We can put the 100 in there because we've prepared him for that. So this filter system helps you go back and fill in your holes. So right, I can't know that I didn't do it, that I missed something. I have to do this myself every time I put a program together. Now, so the only hole that I've seen that we've addressed all the goals. We're going to simulate the work activities, which is not going to be a Pilates exercise, but we're going to do that with him. And then we're going to go back here and let's put in 2 mat exercises for him. Now we said the 100. Okay, so that's great. What's another exercise that would be good for him?
Sideline series, you have it, but you progress it.
How about the side lift? What a great exercise that would be. So side lift is actually part of our fitness screening, and it's a preparation for the upright side kick, you know, when your hips are lifted, so that's a more advanced Pilates exercise. So the side lift would be great because it is shoulder stabilization, it's core control, it's pelvic stabilization, it's hip abduction and leg strength, and it's ankle alignment. So it's like the full meal deal. Like if you're going to do one exercise every day, that's a really good one because it does a lot. So you could choose a lot of other things. We might want to choose something like a prone extension type exercise. You know, maybe more advanced swan would be good for him. Maybe swimming would be great for him. You know, so he gets some real good, you know, postural alignment. So I would love to see swimming in there too. You have that? Yep. I just saw it. Mat swimming is in S4.
That was all the swan endings.
Yeah, so that was, your S4 is your extension course. Yeah, exactly. So something like that would be great for him, getting that hip extension, that extension. But that's the way you kind of use the filter system to go back and make sure you've done everything that you want to do. The next filter is progression from one week to the next week or one program to the next program. And does your session flow from one exercise to the other as you finish? Okay? All right, good.